Welcome to Open BxRx Tuesday on BronxNet. I'm your host, Kibin, and I'd like to invite you to get social with us at BronxNet TV on Instagram and Twitter, and BronxNet Community Television on Facebook. May marks the start of Asthma Awareness Month. Joining me to discuss the effects of this health condition on residents in the Bronx is Dr. Zoya Treyster and Dr. Laura Conrad of the Children's Hospital at Montefiore. Thank you both so much for joining me.
Happy to be here.
Now,
thank you for having us.
So now asthma is a common health condition in this country affecting about 1 in 13 Americans. How does asthma actually affect our breathing and our overall health?
So asthma is a very common disease. As you said, it affects close to 6 million children in the United States. And it's characterized by recurrent episodes of coughing, wheezing, and chest tightness. And it causes inflammation, swelling, and mucus in the airway. And there are different triggers that cause these asthma exacerbations. That could be the common cold, environmental exposures, smoke exposure, and air pollution. And as you can imagine, this is very challenging for both patients and families and affects their quality of life. It can affect a child's ability to be active, to participate in sports. It can affect their ability to attend school regularly, which in turn can affect parents' ability to go to work. But the good news is that asthma is treatable. By taking preventative medications, we can help prevent these asthma attacks from happening.
Now, according to previous Montefiore research, the rate of asthma prevalence in the Bronx was as high as 25%, and that's the highest rate of all of New York City. Dr. Treyster, is that still the case today?
Yes, depending on the studies, the rate of asthma in the Bronx is somewhere between 15 to 25%. And it certainly definitively is the highest rate in New York City.
Now, why do we continuously see this type of pattern in the Bronx in regards to health outcomes?
So that's a good question. So here in the Bronx, we have a lot of neighborhoods with high poverty rates. And in those neighborhoods, there's a lot of substandard housing, which lends itself to children and families to be exposed to a number of environmental triggers that can exacerbate their asthma and affects the severity and the frequency of of their asthma attacks. In addition, these neighborhoods have inequitable exposure to environmental hazards such as air pollution. And we also know that children who live in these higher poverty neighborhoods tend to seek medical care for their asthma at urgent care centers and emergency departments. They're really receiving more episodic care, meaning when they have an asthma attack, they go in, they get treated, but they may not totally address their needs for controller medications and have significant continuity of care to help prevent further and future asthma attacks.
Now, you talked about air pollution contributing to the amount of people that have asthma. How much does that actually impact your risk of getting asthma?
So air pollution contributes to asthma because it activates non-allergic pathways. So it will contribute to airway inflammation in basically everyone. What we know about kids is that there are certain kids and adults who are prone to allergies and therefore at higher risk for the allergic component, but the non-allergic component, the airway activation that happens with pollution, really does happen in everyone. So if you have a genetic predisposition, you're going to be at higher risk for developing asthma. And prior studies have shown that your proximity to certain highways and high pollutant areas will make a difference as well. And as anyone who's been to the Bronx knows that basically anywhere you go, you're going to be close to one of the three major highways that will run through the Bronx. So certainly air pollution and the proximity to highways, to roads, to cars makes a huge difference in the development of asthma in the patients we see here.
Now, since we're on the topic, what are the most common causes of asthma?
So we know that asthma is multifactorial. Asthma tends to run in families, and so there's certainly a genetic component to asthma. We also know that the most common triggers for asthma include the common cold, viruses, and there's also environmental exposures that can trigger and also lead to the cause of asthma, including indoor allergens like dust, pests like mice and roaches, mold, and secondhand smoke exposure.
Now, you both work at a children's hospital, so I'm really curious. Dr. Treyster, can you tell me, how does asthma affect children in comparison to adults?
So asthma it's a large umbrella term that encompasses several different manifestations of disease. And as time goes on, we're getting much better at differentiating which type of asthma each particular patient has. So there's the classical way of thinking about it is that there is allergic asthma and non-allergic asthma. This is a simplification because a lot of patients will have features of both. But children in general will be prone to the allergic form of asthma. And adults, when they have adult onset asthma especially, will be prone to the non-allergic form. So allergies will influence a child's predisposition, allergies and family history to allergic asthma. We call that the atopic march. You can start off with eczema, with food allergies, allergic rhinitis, and then eventually you will see that many patients that develops into asthma over time. There are other factors that influence asthma. Exercise, so you can have just exercise-induced asthma. You can have allergic asthma, and a lot of patients with allergic asthma will still have exercise-induced symptoms. Obesity definitely predisposes children and adults as well to asthma by triggering the non-allergic pathways. And the main difference is that pre-puberty asthma will affect females. So I'll start that sentence over. Pre-puberty asthma will affect males more than females, and then after puberty that switches, and females are more affected into adulthood as well.
Oh, wow, that's interesting. I didn't know that, so thank you so much for sharing. Now, Dr. Conrad, I understand there are some newer biological medications. Can you tell me more about that?
Sure. I think Dr. Treyster may be better suited to answer the question.
Okay, yeah, we can
I don't know if you
definitely
want to
do
take
that.
that. Okay.
So the biologics are really exciting. It's a really exciting time in asthma because of the development of the biologics. We just had the sixth one approved for asthma. 5 of the 6 are approved in the adolescent or younger ages. And it's really changed the frontier of asthma. So before we just had our inhaled medications, we had some pills you could take. And once we reached the maximum inhalation dosing, a lot of patients were stuck taking oral steroids, which have really broad effects in the body and a lot of side effects that we don't want. With the introduction of biologics, we've been able to put a lot of patients on these injectable medications that target specific molecules. And because of their targeting, they are both very effective. Especially for allergic asthma, we have more options for allergic asthma, which, as you recall from a prior question, affects children more, but also really decreases the side effect profile. So a lot of these medications, basically all of the biologics, have way less side effects than the inhaled steroids that patients were previously locked into if their asthma couldn't be controlled. And they are able to live much happier, kind of freer lives because of it. So we have a lot of our patients on these newer medications that are targeted towards their individual profile. So it's like the introduction of individualized asthma control into this sphere, and that's very exciting for all of us.
Now, I know this remains an issue for children of color or those in low-income areas, also known as minorities. What are some steps parents should take to prioritize their overall family health?
So in terms of asthma control, it's really important for children to regularly see their doctor. It's also important for children to take their medications regularly as prescribed. This is the best way to prevent asthma attacks. Also identifying triggers and trying to avoid those triggers. And in terms of overall family health, living a healthy lifestyle is very important. We've seen a great rise in obesity since the pandemic. And so staying physically active and eating a balanced diet as a family is really important, because weight can definitely affect asthma and these children's respiratory disease and their ability to be active and live healthy lives.
Now, are there any Montefiore resources or info sessions available where people can learn a little bit more about how to protect their families?
So you always want to start with your primary care doctor if you have any concerns about your asthma. Dr. Conrad and I are jointly involved in the Asthma Center, which is a really great resource that specifically targets our higher risk patients who have either a lot of hospital visits, a lot of urgent care visits, or in general, we get referrals for patients that just have a hard time controlling their asthma. It is a really great resource for the Bronx community in general, and your primary care doctor can definitely refer you to one of our clinics. And over the course of several visits, you see both allergy and you see pulmonary. And we test you for allergies. We do testing of your lungs, and we craft a plan, an individualized plan for the control of your asthma. And we don't really release you back back to primary care until we feel like we've done a really great job of managing your asthma and making sure you have a sustainable plan going forward. So it's a phenomenal resource. We have a health educator, and we have breathing tests available. That we have resources that otherwise aren't necessarily available in the primary care setting, and we can utilize that to really help.
All right. Well, thank you both so much for joining us to talk about this really important discussion. So we really appreciate you taking the time to speak with us. All right.
Thank you for having us.
We'll be right back with more Open BxRx Tuesday.